So it created an issue with the ability to prevent chronic disease is one section of that. But the other end of that is once these insurance conglomerates got a hold of our healthcare institutions and took over, they began to profiteer off of the chronic disease. Yeah.
So what's the difference?
The idea of healthcare insurance started right in Houston, Texas, in the Texas Medical Center with Baylor. Baylor Hospital began to offer insurance plans to patients to try and make it a consistent payment plan where they could have accessibility to preventative care. And that was the premise of what Baylor did.
So health insurance is a fairly new idea?
Well, since the 1930s, but it got captured in the 80s and became HMOs. And so essentially, once it was HMOs, it became a profit center and it changed, it pivoted. And so the money that's being made off of every single chronic disease and by delaying the onset of these procedures and surgeries.
What's the difference between an HMO and like pre-1980s health insurance?
So prior to the 80s, your doctor knew you. They knew your family. They showed up with their little leather bag. They knew everybody in the family. They spent time with you. In the system we have today, because the insurance companies control the doctor's reimbursement rates, the clinician only spends 6 minutes with you on average here in the United States. And in 6 minutes, how can they possibly uncover the root cause, talk to you about family history, diet, lifestyle, nutrition, which they're not trained on in the first place? Trump actually yesterday announced that he was going to break up PBMs. And when I talked to Bobby Kennedy, I was walking him through the PBM and what it is. So many people say these middlemen, or even when I did Bobby's podcast, he said, what is a PBM? I have insurance, not a pharmacy benefit manager. And I said, you have a pharmacy benefit manager that claims that it outsources your drug coverage to a PBM. But the truth is they own the PBM. It's like Scooby-Doo. So you pull the mask off and it's like, oh, it was Mr. Rogers all along.
So a PBM stands for Pharmacy Benefit Manager.
Pharmacy Benefit Manager. And they were established in the 70s to be an advocate for the American people to drive down the cost of prescription drug care. Their job was to negotiate on our behalf to drive down the cost of our medications.
Yes.
And along the way, as the insurance companies became a for-profit institution, guess what they did? They went out and they gobbled up all of the middlemen. So the pharmacy benefit managers in America are all owned by the 5 big insurance companies. So when you pull back the layers to the onion, what you find is they've turned the PBM into a profit center. So rather than negotiating down the cost of prescription drug care, they negotiated up the cost.